I'm from Columbus. Actually grew up here, probably about 3 miles from here. My dad had a grocery store and subsequently a Gulf oil station on Brown Avenue. So really I was born in Columbus, raised in Columbus, left for college and medical school, came back here, and always thought I'd probably go to a small town to be a small town family doc. But once I got back here for my residency at the medical center, completed that, did 2 years of teaching in that program through Emory. By that time I was back in my church, back in my community, so Columbus was home and I couldn't leave. So this is where my roots are, this is where I'm invested, so that's why I kind of stayed in Columbus. So when I was probably 8 or 9 years old, there was Dr. Snelling, who was our family doctor. And I came down with rheumatic fever at that time and had to be in bed for about 6 weeks. That was the treatment back in those days, where you just put the kid at complete bed rest. And got very close to my family doctor at that time. He was really the original Marcus Welby. And somehow Dr. Snelling became my role model back at that little early age of 9 or 10. And I think from that point on, it just was very appealing to me to be what he was, and that outpouring of warmth and caring that he had was something I really wanted to emulate. So I think he was probably my biggest motivation for getting into medicine, from an interest at a very young age. Back in those days, it seemed as though medicine was a lot more relaxed and seemed to be a lot more personal. The physicians of the community knew each other. There was a close camaraderie among all the physicians, and patients seemed to really appreciate loyalty with physicians, and there was just a less harried pace to medicine. Today, medicine is pressured by many factors outside of the doctor and patient relationship. We have so many pressures to produce, schedules to keep, that it has made medicine a little bit more pressurized. The pressure to stay within formularies for insurance companies, to meet all the criteria for various organizations, for quality measures. There seems to be a lot more pressure on physicians nowadays. At this point in my life, I really want to get back to the way I experienced it in my first office. There were less patients, where I could spend more time, get to know them much better, review their data in much more detail. And I found that that was very, very satisfying to me, as opposed to now having to rush through a day, create electronic medical records, to the point where it was just, it's a very harried day. So I would like to have a day where I felt like I had adequate time to spend with people to do the job that I think I need to do in providing excellent health care. I think when patients come in to a new style of practice, I will immediately have more time to see that patient and to explore all the ramifications of their health and plan their health preventive approach. I think that seeing them on time, not only will it help them in their schedule, but it will take a huge amount of stress off of me, because the way medicine is today, that's one of my biggest stresses, is holding people up, getting behind on the schedule. So I think just time to devote more to the individual, to have more time, to see them on time, and if necessary the next day to be able to get them in to follow up on what maybe have gone on the night before. I think that as I take care of myself, take care of my own emotional needs to do good care, that it will spill over into the practice, and that people will feel more cared about, that they will be feeling more listened to, and I think they'll just generally get better medical care. I would say to someone considering coming into this new practice that if you value a relationship with a physician, I would certainly value that relationship with you, and that through that we can mutually develop what we think is very important for your health care in the coming years, and that we will develop priorities that I will make a commitment to you to stay as up to date on medicine as I can be, that I can keep good information flowing to you that I think is latest and best medical care. And I think that this is going to provide you with an opportunity to be listened to a little better than maybe in the past, that we will have time to explore nuances of your care, to see how we can maybe help your family as a whole, and just develop a plan for you to do well and to be well. As I try to develop that feeling as though I've got more time with my patients and can have a more relaxed approach in my final, hopefully 8 years or so of practice, that I would like to actually, my pride and joy, the family that I have around me, just looking at my little family who have just moved to Milledgeville, and my grandchildren, as I look forward to having a time in my life where I've got space to develop my own health, my own emotional health, to surround myself with those people who are very special to me, and for it to be more than just my medical family, but it can be my family, my grandchildren. So that's an added benefit that I think will help me and give me the energy to therefore give to my patients. So I look forward to that. I look forward to this change.
Hi, I'm Julie, and I'm one of the folks helping your physician make some exciting changes to their practice. Many doctors are seeing more and more patients every day, and as a result, spending less and less time with them, spending less time with you. And of course, long wait times is a frequently heard complaint. But today, you have the option to join a different type of practice. Personalized healthcare, also frequently called concierge medicine, connects patients and doctors in a highly attentive, long-term relationship that promotes both health and wellness, and provides patients with an advanced level of care and service, as well as unprecedented levels of access. Your physician has made the difficult decision to reduce the size of his practice down from several thousand to just a few hundred, but both you and your physician can greatly benefit from having more time together. In your physician's new practice, they'll be able to provide you with the type of care that you may not have seen for decades. It's a return to days of old when your physician could take as much time as needed to address all of your health concerns and also be able to provide you with a proactive approach to your health care. Some of the benefits of your doctor's new practice may include same-day, next-day appointments that start on time. When you call into the office, they make it a priority to fit you in as soon as possible, and when you arrive, you won't be kept waiting. 24/7 availability. Not only can you be seen almost immediately, you're also provided with your physician's cell phone number and email address. That makes getting a hold of your doctor easy. If there's an after-hours or weekend emergency, you'll have the peace of mind that comes from knowing your provider is just a phone call away. Extended routine visits and an expanded analysis of your annual exam, including in-depth health risk assessments. Afterwards, your doctor will be able to provide you with an individualized treatment strategy and physician-guided wellness plan to help you move toward optimal health. There's also referral coordination with specialists. In a concierge practice, your physician is deeply committed to you and to your overall health. By acting as your medical home, this model allows your physician to take a more proactive and preventive approach, and we encourage you to view your doctor as a quarterback of all of your healthcare needs. By including your physician in the referral process, a joint effort can be made with other physicians to provide you with an enhanced level of overall care. And there's also a family plan that may include your dependent children up to the age of 26 for no additional charge. Your doctor is very excited to be able to provide the level of care and service to his new members, and concierge patients see the benefits as well. You may be surprised to find out that thousands of physicians across the country are adopting this new personalized healthcare model, which results in thousands of patients just like yourself participating in this new type of care. It may also come as a surprise to find that the annual renewal rate for patients in this type of practice is well over 90%. That means that patients are overwhelmingly happy that they made the decision to join and keep coming back year after year. There is an annual membership fee to join your concierge physician's practice, but the cost is about the same as a gourmet cup of coffee every day. This fee isn't covered by your health insurance, but works alongside of it. Your concierge physician focuses on the entire continuum of care: prevention and early detection, diagnosis, treatment, education, and management. But space in your doctor's new practice is limited, so I urge you to find out more information by speaking with your physician's on-site transition manager, calling our 800 number at 855-275-4381, or visiting our website at www.yourcypress.com. We look forward to speaking with you in much more detail at your earliest convenience. And please take a few minutes to read or listen to some of our highly satisfied concierge patients and their testimonials. But keep in mind, if you decide that this isn't the right fit for you, or you decide not to join your doctor's new practice, don't worry. We'll be happy to explain the details and the options your physician has already set aside for you.
This is like what it was, I won't say how many years ago, but we would be able to call a doctor and get, go in and see him, and I haven't had that in years. It's just been years, and this has worked out really well.
He is able to spend more time with us, and we enjoy that. When we signed up, he gave us his cell number, so I could text him, I can call him on the phone.
Having this relationship, I'm able to pick up the phone and ask him his opinion. He's able to triage me in what direction I need to go in. If it can wait till Monday, if I need to get called in a prescription for me or my children over the weekend, if we're going on a vacation or a trip.
I can call the doctor anytime I want. I can get a hold of him anytime I want. It was in the past, whenever I needed to just ask a question, I would have to make an appointment, which would be 2 weeks away.
Waiting for a call back because of patient loads, and that could take a while. But the response, the peace of mind it gives you.
When we come in, we get to see him right away, and it gives us a feeling of security, because like he explained to us to begin with, it's like having a doctor in your family.
Being retired, it's all about time management. It really comes down to that. One of the major things that caused me to go into this was the timing. I know that he has a slotted time. I can call anytime, and I can get in to see him if something's up.
Well, I've experienced through many other doctors that there's not any time when I go in to see the doctor to sit and talk with him about my problems or what's important to me is health-wise. And this service came up, and I thought it was a lifesaver.
And so I ask questions, I ask a lot of questions, and he takes time, he answers my questions, and I enjoy that. I don't feel rushed. So that's very, very important.
And I thought, oh, well, this is what the future is. This is how we're going to be able to be taken care of properly, because that's really important to me.
I would say, with my history, with my parents, it doesn't matter if you can afford it, what it is so beneficial.
To me, it's a good investment. It really is. I believe in prevention, medication, and that way we can stay healthy. I mean, we're not young, we're not old, but we're not young either. And so investment in our health is very, very important.
The other thing that for me is time. Again, having this relationship and being able to schedule a time that's on my time. Whenever I have to bring my child in, you have to think about missing school. They have to miss school, you have to pick them up, they miss their assignments, and it's just so important to be able to make it as quick as possible, make it as easy as possible, and on my schedule.
It's like it used to be a long time ago when I was growing up as a child. That's how it was. And as I grew older and things changed, that got lost. But now I have it back.
I wanted one doctor who would be available for my total care.
I love it. I love being able to call him and tweak, you know. Call him and say, oh, I'm feeling bad today, you know, can you see me for a minute? And it works out good. Plus there's a lot more interaction. He can sit and talk to you for a minute, ask you where you're going with your health and how you're headed there.
You know, in our 50s and all of a sudden starting to deal with things like blood pressure and cholesterol and that kind of thing, we felt like it was kind of an important time in life to take that much attention.
And by being a concierge doctor, you have that rapport with your patients. You have the time to do that with your patients.
There's just a trust there that is comfortable.
His staff is as knowledgeable about the patients as he is. They know who I am when I walk in the door.
So it's worth it to me, you know. It's definitely worth it.
Coming to Concierge is just different. You just, you know, it's just quick and easy.
The peace of mind that I have knowing I can go to bed at night and that I am well taken care of. The other physicals I've had have been nothing like the ones here.
The checkups and physicals annually are very thorough, you know, a lot more than a normal doctor practice would have the time for.
There's no rush. It is, it's just like having a conversation. And he asks lots of things that you hadn't even thought about, things that come up that kind of make you stop and think that maybe I should be thinking about this.
Having somebody that gives you that thorough of a test every year so that you know exactly where you are and they're really paying attention to it and taking their time with you, you know, makes you feel a lot more secure.
And you know that somebody really is watching out for what's going on with you. It's not forgotten about, it's not stuffed away, it's not in some file, and it's your responsibility. He calls me back and tells me where we stand on whatever the issue happens to be. So it's good.
You kind of have to pay a little bit more to get that kind of attention. And to me, for my health and my husband's health, that's money well spent.
I know that I get well worth what I put into this practice monetarily back in the concern and care of my well-being.
I think just that personal attention that it's just so much more thorough.
He respects my time. I don't come in and have to wait 30 minutes or an hour to be seen. That's huge nowadays. And in a larger practice, you know, some of the other doctors I've been to, I have waited up to 3 hours before. And that's not acceptable.
Oh, there is no wait time. There is no wait time, totally.
I work, you know, in my own business, and for me to stop and take the time to come to the doctor for checkups and exams, you know, to be able to have it scheduled and just address it right then, or if I don't feel good, to be able to just come straight here in the morning and say, you know, I need some help. It's important.
You can call him 24 hours a day. He has a cell phone that he does answer at 3 in the morning if you need him.
Really and truly, the difference is you can call him anytime, you can come anytime. I came for blood work the other day, came in, took 5 minutes and left, and I thought, man, I have never been to the doctor where you just walk right in, get your deal done, and off you go.
If he doesn't answer the phone, he calls us back within, 15, 30 minutes, something like that.
He will come to your house if need be.
It's just easy, really personal. It's great.
The time is so precious. You walk in and you're seen. You don't have to wait.
I think it's been an easy transition. A lot more time, a lot more availability. I like it.